Tetanus is a serious infection. It affects the nervous system, leading to painful muscle contractions. It's often called lockjaw because it frequently causes the jaw muscles to tighten. Tetanus is a global health concern and can affect people of all ages. However, it is more common in developing countries due to limited access to healthcare and vaccination. Tetanus is not contagious, meaning it doesn't spread from person to person. However, it is a life-threatening condition that requires immediate medical attention. Understanding tetanus, its causes, and preventive measures is crucial. This knowledge can help us protect ourselves and our loved ones. Clostridium tetani is a bacterium that lives in soil, dust, and animal waste. It thrives in environments with low oxygen. The bacterium produces spores that are very resistant and can survive in harsh conditions for years. When these spores enter the body through a wound, they become active. This often happens through cuts or punctures, burns, animal bites, or drug injections. Once active, the bacteria release a toxin called tetanospasmin, which is very potent. It travels to the nervous system and interferes with nerve signals, causing the muscles to contract uncontrollably. The symptoms of tetanus usually appear within 14 days of infection. However, they can take as few as 3 days or as long as 21 days to show. The severity of symptoms varies and depends on the amount of toxin in the body. Early signs of tetanus include jaw stiffness, difficulty swallowing, headache, fever, sweating, and restlessness. As the infection progresses, muscle spasms become more severe. These spasms are very painful and can cause muscle tears, fracture bones, and interfere with breathing. Section 4. The many faces of tetanus, different forms, shared danger. Tetanus presents itself in different forms. Each form affects the body differently. Generalized tetanus. This is the most common form. It affects the entire body. Muscle stiffness and spasms occur throughout. Localized tetanus. This form affects a specific area of the body. It is often near the site of the wound. Cephalic tetanus. This rare form affects the head and neck. It often follows ear infections or head injuries. Neonatal tetanus. This form affects newborns. It occurs when the umbilical cord is cut with unsterile instruments. Regardless of the form, tetanus is a serious condition. It requires immediate medical attention. Section 5. Facing the threat. High risk factors and mortality in tetanus. Certain factors increase the risk of severe tetanus and death. These include lack of vaccination. Vaccination is the most effective way to prevent tetanus. Unvaccinated individuals are at the highest risk. Deep or contaminated wounds. Deep wounds or wounds contaminated with soil or manure are more likely to harbor the bacteria. Delayed wound care. Prompt and proper wound care is crucial. It helps reduce the risk of infection. Weakened immune system. People with weakened immune systems are more susceptible to infections, including tetanus. Mortality rates from tetanus are highest in infants, the elderly, and people with underlying health conditions. Prompt medical attention significantly improves the chances of survival. Section 6. Combating the silent invader, treatment, and intensive care for tetanus. Tetanus is a medical emergency. It requires immediate treatment in a hospital setting. Treatment usually involves wound care, cleaning the wound thoroughly to remove dirt, debris, and bacteria. Antibiotics, to kill the bacteria and prevent further toxin production. Tetanus immunoglobulin, to neutralize the tetanus toxin circulating in the blood. Muscle relaxants, to control muscle spasms and prevent complications. Intensive care is often necessary. This may include mechanical ventilation, to assist breathing if the respiratory muscles are affected, nutrition and hydration, through intravenous fluids as swallowing can be difficult, preventing complications such as bed sores, pneumonia, and blood clots. Section 7. Shielding ourselves, prevention through vaccination and wound care. Prevention is key in the fight against tetanus. The tetanus vaccine is highly effective. It provides long-lasting protection. The tetanus vaccine is usually given as part of the DTaP vaccine. This vaccine protects against diphtheria, tetanus, and pertussis. It is given in a series of 5 doses. These doses are given at 2 months, 4 months, 6 months, 15 to 18 months, and 4 to 6 years. Booster doses are recommended every 10 years throughout adulthood. Proper wound care is equally important in preventing tetanus. This includes cleaning the wound thoroughly with soap and water, applying an antiseptic solution, keeping the wound covered until it heals, and seeking medical attention for deep or dirty wounds. By staying up to date on vaccinations and practicing proper wound care, we can effectively prevent this silent threat.